Hi, folks. Welcome to our third candidate webinar in our summer candidate webinar series. We are joined today by Laura and Brody of New Hampshire Hunger Solutions. We're going to give folks 3 or 4 minutes to hop on the webinar. And while we wait, I will just quickly go through what the format will be. So Noah from our communications manager at New Hampshire School Funding Fairness Project will present first for about 20 minutes, followed by Laura and Brody. And at about 12:45, we will start doing Q&A. The way that we will do Q&A will be through the chat. So as you have questions throughout the two presentations, put your questions in the chat, and I will make note of them to ask as we begin Q&A at 12:45. For folks that are on the call, if you want to just quickly introduce yourself in the chat with your name and the town that you live in and the office that you're running for, that would be great. And other things to note, we will be sending around a recording of this presentation following the webinar today. So long as you signed up on our registration form, you will get an email later this afternoon with a link to the recording, as well as the slide decks and materials from both organizations. Just give folks another minute. And for folks who joined maybe after I went over what we're going to be doing for Q&A, as you have questions throughout the two presentations, you can put them in the chat and I will make note of them to ask as we move into Q&A at the end of the webinar. And I think with that, Noah, I will go ahead and turn it over to you.
Hello, everybody. Thank you very much for being here today. My name is Noah Talerski. I'm the communications manager for the School Funding Fairness Project, and I'm going to talk today about the adequacy formula and how the state determines base adequacy for students, where that term comes from, since it's one of the biggest pieces of state funding that we have. So this is our third webinar in this series of 8. We hope you've been able to join us so far and that you'll be able to continue to join us for the remainder of our sessions. We're really excited to be here with New Hampshire Hunger Solutions today. So jumping right in, this is a pie chart that if you've seen any of our presentations before, you're very familiar with this. This is the breakdown of all of the revenue that public schools raised in the 2022-2023 school year. It totals to $3.8 billion and is largely made up by local property taxes. Local property taxes is the biggest piece of the pie. Then you have the smaller blue piece, which is SWEPT, the statewide education property tax. The state takes credit for that, even though the money is raised and retained locally. And then the next biggest part of the pie is the green section is state aid, with state adequacy aid being the biggest piece of that. We broke the lottery out on its own, just because people are very familiar that with the fact that the lottery is part of education funding, but maybe don't always know to what extent. So we're mainly going to be talking today about the state adequacy aid section, which is that 11%. And SWEPT is included. So we're talking today about 20% of school funding in the state. If you look at the 70% of local property tax revenue that is generating revenue for public schools, it's about $2.7 billion that the state is not paying and is being raised by local property taxpayers. A fairly significant amount of that money could very well be part of an adequate education, as the courts have defined, which we'll jump into right now. So we're going to go back in time a little bit to the Claremont rulings in the 1990s. People know Claremont sued the state, but 4 other districts joined them. Pittsfield, there's a typo there. It should say Lisbon Regional, Franklin, and Allenstown, as well as a couple taxpayers and parents, sued the state because there wasn't enough money coming into the district. And in Claremont in particular, Stevens High School was on the verge of losing its accreditation because it didn't have enough funding. Took a long time and multiple decisions, but ultimately the 2 main things that came out of the Claremont suits were that the state has a constitutional responsibility to provide an adequate education to every K-12 student, and that the taxes used to pay for that education must have a uniform rate across the state. So we're going to focus on that first piece. What does adequate mean? It's kind of a weird word to choose, but it's what the courts have left us with. So the courts ultimately left it up to the state legislature to define an adequate education, but they did give us some hints about what they thought adequacy meant. This passage that's on your screen right now is from the Claremont 2 decision, which was issued in December 1997. And I think what it speaks to is a court that was looking at the turn of the century. You know, they were seeing the year 2000 just on the horizon. There were new technologies and computers, and the internet was starting to be an important part of the global economy. And the courts recognized that reading, writing, and arithmetic was not sufficient for New Hampshire students to be able to engage as productive members of the New Hampshire economy, of our national economy, and to be able to compete in a global marketplace. And so the definition that they set out is pretty broad and encompasses a lot of different skills and subject areas that students need to thrive in the workplace. So this is the guidepost that the court set out, but they left it up to the legislature. So it took another lawsuit to get there. The 2006 Londonderry decision reaffirmed the court's order that the state really does have to define an adequate education. And so in 2008, a legislative study commission released its final report on defining an adequate education. And what they came up with is the idea that an adequate education is made up of key subject areas, and that students need to have the opportunity to learn information from these key subject areas. So there's 11 on your screen. There weren't 11 in 2008. Some of these have been added since then. And some of these items have been amended. For example, the social studies item, I believe in 2021 was amended to include Holocaust and genocide studies as part of the social studies adequate education. You might also have heard about the bill from this past session that included multiplication tables and cursive writing as part of an adequate education. So these are the high level things. And these all look like classes that you'd probably be familiar with, you taking, your own children taking at their schools. But this is just subject matter, this doesn't help us actually figure out what this might cost. So that was the other part of this 2008 commission's charge, was coming up with the cost to go with this definition. And what they determined is there's a pretty big list of things that you need to be able to deliver that adequate education, to give those students an opportunity to access the information in those 11 subject areas. So what they came up with is a teacher, obviously, using the maximum allowable class sizes of 25 students for K-2 and 30 students for 3-12. Specialist teachers to be teaching music, foreign language, gym, those sorts of classes, principal and administrative assistant for the principal, a guidance counselor, a librarian, a technology coordinator, one custodian for 500 students. I don't know about you, but that sounds like it might be a bit of a messy school. And then on top of that list of staff, there's some other things that are needed, textbooks, technology, teacher professional development. So teachers are always learning about the best and most up-to-date practices and ways to do their lessons, facilities, operations, and maintenance. You got to have the lights on if the kids are going to learn. You got to have the heat running in the winter. You need to be able to plow the lot, and transportation. You have to be able to get kids to and from school. Otherwise, they're not going to be able to learn anything. And so all of these numbers are 2008 values, and what they got was a base adequacy cost of $3,456. That is what the state legislature in 2008 determined it would cost the least needy student to learn all of this material, to have the opportunity to learn all of this material. If you adjust that for inflation, roughly from 2008, you get our current number of $4,100 in base adequacy. So as part of the Claremont decision, which established the state's responsibility to pay for an adequate education for all students, the state created adequate education aid and pays this base amount for every single student in the entire state. But that's not it. The state has determined that there are a couple categories of students that require additional resources. It's more expensive to educate them for various reasons. And those three categories are called differentiated aid. So the first is an additional $2,300 for each student who is eligible for free and reduced price lunch. Now, this is not the state paying for the student's lunch. This has nothing to do with the student eating lunch. This is just how the state measures poverty. The state uses the free and reduced lunch forms that are returned to districts. That's how they measure how many students in a district are living in poverty. There's a couple other ways that could be measured, but this is the current one in statute. That is how the state measures that, because they've decided that students from low-income families do sometimes require more services to be able to achieve at the same levels as their peers. Next, there's $2,100 for each student receiving special education services. So that is for any student with an IEP, an individualized education program. The state will pay the local district $2,100. That doesn't really come close to the actual average cost of special education. If you joined us last week for our presentation with the Disability Rights Center, you would have seen more about that, and you can find that recording on our website. But the average additional cost of IEP services per student with an IEP is close to $29,000. So this $2,100 is not really that close to what it actually costs to provide these services. And then lastly, the state pays $800 for every student who is an English language learner. Often districts need to hire special staff and teachers to be working with these students. And you add all of this up and you do a weighted average based on the different attendance measures for each of these categories, and you get an average adequacy grant per student of $5,995 for this previous school year. And it's a lot of money, that's the average, but it's not actually that close to what districts are actually spending to educate their students. The average per pupil cost in the state during the 22-23 school year was over $20,000. So what's being provided in adequacy aid is only is a little bit more than 25% of the actual cost. And this is different in every district, but there is not a single district in the state that comes even close. You'll see here Manchester has one of the lowest per pupil expenditures of any district in the entire state. And what they receive in adequacy is less than, I was going to say a third, it's more than a third, but it is less than $10,000, it's $10,000 less than what they're actually spending to educate their students. And there's a lot of reasons why that's the case. Partly, the amount of money the state selected for these different services were underestimates. So I'm just going to go back a little bit. This salary number that they developed for teachers was based on at the time the average salary of a third-year teacher, because the legislature said, well, we can't have all brand new teachers in a school, but they certainly were not thinking about veteran teachers who might be making more. And there's certainly a lot of benefits to having veteran teachers. They also used the maximum allowable class size when doing this calculation, when a lot of districts, either because they have low populations generally, or because they don't quite have a round number, they don't operate on the maximum allowable class size. If you have 26 second graders, you need to have 2 second grade classrooms. Even though you only have one more student, you can't exceed the maximum allowable size. And the same things goes, with the idea of like 400 students per guidance counselor. What do you do if you have 401 students? How many guidance counselors would the state say you need? And some of these things are just gross underestimates. Transportation is very low. In some more rural districts, the transportation cost per student can easily be in excess of $1,000 a year. So this number that's included here is pretty insignificant relative to the actual cost. And that creates a pretty big gap for districts that they have to make up. And as you can see, the state subtracts SWEPT from the adequacy grant, the cost of an adequate education, when it's giving money to local districts. So it tells Manchester or Northwood, here is the SWEPT rate. It's a little over $1 per thousand. Those communities raise it, and then the state takes credit for that money, and then closes the gap between that and what it says the cost of an adequate education is. So what does this gap actually look like in real life? So we did a little exercise with the Allenstown School District. We worked with the superintendent, the vice chair of their school board, and we asked them the question, what would your budget look like if you were operating only on adequacy, if you were only using adequacy funds to run your school? Because that's ostensibly the purpose of adequacy funds. They're supposed to be able to pay for students to receive those 11 subject areas, to have that opportunity to learn all of that material. So if that's the number from the state, can it actually work in reality? So in the 22-23 school year, the Allenstown School District budget was a little over $12 million. They're a small district near Concord. Smaller districts often have higher per pupil expenditures just because they can't benefit from the economies of scale that larger districts can. That $12 million is the budget that was approved by voters at town meeting. That was approved by the Allenstown residents. The state, meanwhile, says that the cost of an adequate education that year was only $2.4 million. So we asked them, what would it take to get from 12.2 to 2.4 million? And what would the Allenstown district look like if it was operating just on adequacy? And they had to cut a lot of stuff. Right off the bat, cutting busing here, that violates state law. School districts are required to provide buses. Firing art, music, and PE, or getting rid of art, music, and PE equipment is going to make it pretty difficult to deliver the adequacy requirements within those courses. We're getting rid of the SAU costs, which means we're not going to have a superintendent, which also violates state law. There's no food service, which violates federal law. And the list goes on. We're not having English language learner support. We're getting rid of a lot of special education contracted services. Those are services that have to be provided under federal law. And now the district is going to have to find a way to do them in district instead of contracting them out. There's no clubs, there's no summer programs. We're firing a whole lot of support staff. We're firing the art, music, and gym teacher. And we have a lot of serious violations here. We're violating federal law by impacting the ability of students with IEPs to receive a free and appropriate education. We're violating state law by getting rid of busing and certain teachers. We're violating local collective bargaining agreements. And we still haven't even gotten all the way there. In Allenstown, they don't have their own high school. They tuition students to Pembroke Academy. They spend $2.2 million a year just on tuition to send their high school students to Pembroke Academy. They can't control that line item, so it had to be cut. And even then, to get the rest of the way to the $2.4 million number that the state says is adequate, we have to fire about half the teachers. So when they approached this exercise, The Allenstown staff that we worked with said, well, the state has defined adequacy as this course material, students being able to have access to these classes. So we're going to try and keep as many classroom teachers as we can because that's what we see the core of adequacy being. But after they cut all the extra stuff like buses and they still had to fire half the teachers and end up with a student teacher ratios that exceed the maximum allowable amount under state regulations. And I'll say again, they're not sending their kids to high school. An adequate education in Allenstown will end in the 8th grade. And that begs the question, how can we possibly say that the amount of money being provided by the state for adequacy is close to an adequate education? It doesn't come close to the actual cost of education. It doesn't come close to covering the services that the state says it should be covering. And it's not sufficient for actually providing the adequate education that the state has a constitutional charge to provide. So there is going to be a little bit of change for this coming school year. This was a change in the state budget that was signed into law last year, where adequacy numbers will actually adjust every year, as opposed to every other year, like was the case from 2008 to 2023. So as you can see, it's going up about 2% in every category, and we've estimated here an average adequacy grant of a little over $6,000 per student, which is still far below the actual cost of education. And so the question I'll leave you with before I turn it over to New Hampshire Hunger Solutions is this money sufficient for an adequate education? Is what the state is providing adequate to fulfill the needs of and services that the state says districts need to be able to provide? We know we need to get kids to and from the building on a school bus, but the state is not including nearly enough money to make that happen. We know we need to have teachers, but the state seems to think that school districts are going to be comprised entirely of third-year teachers. And so there's a lot of issues with the way that we've come to this number, but it's a legislative process that can easily be done again. It's just a number in state law. And we've had a number of other study commissions conducted since 2008 that have built on that work, and I think would help update this number if their recommendations were looked at more seriously by the legislature. So I will stop there. I will hand it over to New Hampshire Hunger Solutions, and I'll start going through the chat to be able to answer some questions when they're done.
Thanks so much, Noah. I am attempting to share my screen. Give me a sec. Okay. Are people seeing my screen?
Yep, you're all good, Laura.
Great. Hi, everyone. I'm Laura Milliken. I'm the Executive Director of New Hampshire Hunger Solutions, and I'll pass it to my colleague, Brody, to introduce himself.
Thank you, Laura. This is Brody Deshays. I'm the Communications and Policy Manager with New Hampshire Hunger Solutions, and it's great to be with all of you today.
So New Hampshire Hunger Solutions is a statewide, nonpartisan, nonprofit organization that advocates to end food insecurity, improve equitable access to nutritious food, and address hunger's root causes for all New Hampshire residents. Brody and I are going to talk today about hunger in New Hampshire and what we can do about it. So our system of food and nutrition supports is like a power grid, moving healthy food through communities and to schools and to households. In New Hampshire, the grid is well developed in some areas and patchy or non-existent in others. We believe that we could end hunger in the Granite State if everyone eligible for federal nutrition programs like SNAP, which is also known as food stamps, school and summer meals, and WIC, were connected to those resources, which represent our nation's commitment to supporting the health and well-being of any of us who might find ourselves in need of nutrition support. Unfortunately, as you can see in the slide, New Hampshire currently has low participation in federal nutrition programs. We rank 47th in school breakfast, 39th in SNAP, 35th in summer meals, and WIC serves only 54% of those who are eligible. At the same time, recent economic trends, including rising costs of goods and housing and childcare, are straining household budgets. For many, it's increasingly difficult to meet basic needs. The most recent Census Household Pulse survey, this is from June 24th, 2024, found that almost half of New Hampshire children, 46%, and 45% of adults lived in households that reported having insufficient food. We've also provided the statistic that 32% of older adults, and that's adults over 65, reported not having sufficient food. Oops, I went the wrong way. I'm sorry. So why are we focusing on federal nutrition programs? Well, while many people only think of food banks when they think about how to solve hunger, the truth is that the frontline defenses are the federal programs that we've designed to improve food and nutrition security for all of us when we're in need. As I've said before, SNAP, WIC, school and summer meals. While food banks are critical to meet urgent food needs, they rely on charitable giving to operate, and they're not designed to, nor can they solve hunger for the long term. And that's why New Hampshire Hunger Solutions is focused on increasing participation in federal nutrition programs. There's evidence that they significantly reduce poverty, and programs like SNAP give people access to foods that are nutritionally and culturally most appropriate for them. This slide is from Feeding America, the nationwide network of food banks, food pantries, and local meal programs. And it shows that for every one meal that a food bank can provide, SNAP can provide 9. So now I'm going to talk more about challenges and opportunities and strengthening connections to food and nutrition supports. And we'll start with SNAP. So SNAP, the Supplemental Nutrition Assistance Program, also known as food stamps, is the nation's first line of defense against hunger. Older adults on SNAP typically have improved food security, better nutrition, improved health, including lower healthcare costs, better medication adherence, reduced hospital and nursing home admissions. And children receiving SNAP also have better health, are less likely to be obese. Their families are less likely to have to make trade-offs between paying for healthcare and paying for other basic needs like food, housing, and electricity. This is a map that you can see on the New Hampshire Hunger Solutions website data page. In New Hampshire, there are large gaps between those eligible and those enrolled in SNAP. If you look at this last column of data, it shows the estimated percent of the population who are eligible for SNAP but not enrolled. We call that the SNAP gap. It's worth noting that SNAP eligibility went up in 2023, which is part of why there's a big gap. And I'll talk a little more about why else. Okay, before I fill in this next slide, does anybody want to guess what they think the SNAP benefit amount is per meal? Do you think it's $1, $3, $10? Are people guessing? I can't see. I'll just tell
No,
people.
I guessed 4, but we haven't gotten any other guesses yet.
Okay. All right. I will reveal the answer. This average SNAP benefit per meal is $2.83 on average. And you'll see that the average cost of a modestly priced meal in each county is not covered by the SNAP benefit. So this is the actual cost. This is what SNAP recipients get. So there is no county where the SNAP benefit covers the average cost of a modestly priced meal. That said, SNAP is still the best program available for alleviating food insecurity for people living with low incomes. In addition to making sure that people have enough to eat, SNAP is actually good for New Hampshire's economy. SNAP benefits are entirely federally funded. the cost to administer the program is split between the state and the federal governments. SNAP is an effective stimulus for local economies. SNAP is, the U.S. Department of Agriculture estimates that for every dollar spent on SNAP at times of economic downturn, $1.50 is generated in gross domestic product. And that's because people spend SNAP dollars in grocery stores using an EBT card, usually right away. It can't be used for anything else but food. So there have recently been really positive developments, which we think will improve participation in SNAP in the near future. In the 2022 legislative session, New Hampshire Hunger Solutions worked with legislators from both parties to pass a law to require that New Hampshire always have a SNAP outreach plan. It hadn't had one for the previous 5 years, which may be why SNAP participation was so low. In the summer of 2023, the state awarded the outreach contract to the New Hampshire Food Bank, who now has a full-time staff person helping get materials to partners about SNAP and helping people to apply over the phone. Okay, I'm going to hand it off here to Brody for school meals.
Thank you, Laura. Obviously, school meals are an essential part of every child's day in our state, in our schools, and help with their educational outcomes attainment. So we definitely want to touch on that, especially considering our host, the School Funding Fairness Project, has mentioned some of these things in some of the previous slides. So if we go to the next slide, please. So our nation has a national school lunch and breakfast programs, and almost every school district in New Hampshire participates in both of these programs, but not all. So some participate in just the National School Lunch Program. There are some that don't participate in either for local budget reasons or their own, local control in this state, but the vast majority of school districts participate in both. And so this National School Lunch Program is a federally funded meal program operating in public and nonprofit private schools, and it provides a nutritionally balanced, low cost or no cost lunches to children every day. The school breakfast program is also federally funded. Operates in both public and nonprofit private schools and residential childcare institutions, and it provides a healthy breakfast to children, typically before the school day starts. In New Hampshire, all students who qualify for free or reduced price school breakfast will receive a breakfast for free in our state. And we call those no cost meals. Those are no cost to the families or to the children. And there's a lot of benefits to that. Go to the next slide. Free and reduced price school meals. So to receive a free and reduced price school meal, you have to apply. So there are applications, and schools will send school meal applications at the beginning of the school year, but they can be filled out at any time during the school year. Additional state aid is provided to school districts for every student enrolled in free and reduced price school meals by October 15th of each year. So participation in free and reduced price meals does not only benefit a child's access to food and their ability to be healthy, have their nutrition met, and also help them concentrate in the classroom because they're not as hungry. It also benefits the school districts because, as Noah mentioned in his presentation, they use free and reduced price meal enrollment as a poverty measure in our school funding formula. And so the qualifications is for children with incomes up to 130% of the federal poverty level, they qualify for free school lunches or free school breakfasts, and children in households with incomes up to 130% to 185% of the federal poverty level, they qualify for reduced price school lunches. So the children's families will pay for a portion and the federal government pays for the other portion. And in New Hampshire, children in households with incomes up to 185% of the federal poverty level, they all qualify for free school breakfast. So the federal government pays for one part, the state government pays for the excess is what we call it. Go to the next slide. There's also direct certification for reduced price or free school meals in the state of New Hampshire, and that's done through SNAP, TANF, and other programs. So any child in a household that participates in SNAP, which is food stamps, or TANF, which is temporary assistance for needy families, or children who are migrant, homeless, in foster care or Head Start, are categorically eligible for free meals at school. And that essentially means that if they already have the information that you live in a household up to 130% or up to 185% of the federal poverty level, you're automatically enrolled in the program. Children who are categorically eligible are directly certified without needing to submit an additional school meal application. So this streamlines the administrative process and helps increase children's access to food while they're at school during the day. And New Hampshire students are under-enrolled in SNAP and free and reduced price school meals. So as you saw with Laura's previous slide that showed what we call the SNAP gap, when in some counties only about 30% of people or families participate in these programs, it means that they're going to be under-enrolled in SNAP, and because of direct certification, those students are less likely to be directly certified into the free and reduced price school meal program. And we see under participation too in free and reduced price school meals. The application process can be quite burdensome, and sometimes there's stigma. People don't want to be known as the families that need these types of benefits. New Hampshire also needs to increase its school breakfast participation, as Laura mentioned at the beginning of the presentation. Our current rate, only 46% of those who receive a free and reduced price lunch are participating in school breakfast, yet they qualify for those meals, whether it's they qualify for those no-cost school breakfasts. And we know school breakfast is an essential part of every child's day, and it sets everyone up ready with the nutrients to take on, whether it's their work life, or in the case of a student, be able to participate in the educational process effectively and to be ready to handle the rest of the day. There's, as I mentioned, a lot of benefits. Children who participate in school breakfast, they have fewer visits to the nurse related to hunger or other things. They have fewer behavior issues. As you can imagine, we think about how sometimes we can be hangry if we're late for lunch. Well, students sometimes don't always emotionally regulate themselves as well, so they sometimes act out in the classroom, which can disrupt the learning environment for them or for others. It reduces rates of obesity, chronic disease, even into adulthood. So children who participate in school breakfast and school lunch, they're making informed nutritional decisions, and they're eating healthier food. They're less likely to deal with healthcare costs later on in life. They're going to have higher test scores. I mean, we see on average, it's some school districts have 10% to 20% higher test scores when they have no-cost meals or high participation in school breakfast, and higher graduation rates. So children are in schools that have a school breakfast offered, especially no-cost school breakfast, higher graduation rates are pretty common there. We also, as an organization, have really focused on encouraging school districts to participate in or create a breakfast after the bell program, which is an evidence-based method for increasing breakfast participation. We recognize the issue is lower participation, so we want to increase participation. So this makes school breakfast part of the school day, almost like similar to school lunch, how that's part of the school day. It reduces the stigma because all children can eat. No one knows whose breakfast is free, reduced, paid, or who needs to access that program. Everyone's encouraged to participate, and it's part of the regular school day, like any other meal that we'd serve, or a snack break during the school day. And there's several approaches to this. Sometimes, like in a high school or middle school, you might do grab and go carts in specific strategic areas of the hallways where students can just grab their lunch and go, or sorry, grab their breakfast and go, and be able to eat it at the beginning of the school day as instructional time begins. For typically younger kids, it's easier to do breakfast in the classroom, where while a teacher is doing instructional time in the morning, children are provided some food that meets school breakfast guidelines, and they're able to eat that before they might have to start doing some paperwork or worksheets, or open up a book. And then there's also healthy breakfast vending machines, which can be utilized, which is another approach that can increase access. Again, the goal is to make sure that every child is able to access breakfast before the start of the school day, or before they get into the real more strenuous parts of the educational process. And making sure that they have breakfast is, again, going to provide a whole bunch of benefits on top of increased educational outcomes. New Hampshire Hunger Solutions also promotes School Breakfast Challenge, which is a statewide challenge where we work with schools to help them increase breakfast participation, whether it's through different outreach tools that they can do for families in the community, providing them with grants to help with breakfast after the bell, startup costs, or other things that they might be doing to increase breakfast participation. And the school with the highest increased participation is celebrated at an event with press coverage at the beginning of the next school year. So grants with support are available through the New England Dairy Council and UNH Cooperative Extension, who work closely with us to increase breakfast participation across the state and help students access the nutrition that they need to start the day and to be healthy.
Back to me. So to foster the health and well-being of New Hampshire residents, we need to ensure that more communities are plugged into the food grid so that everyone eligible for food and nutrition supports receives it. New Hampshire Hunger Solutions work focuses on 4 areas. We're closing the gap between those eligible and those enrolled in federal nutrition programs. We're supporting schools in their communities to increase participation, particularly in school breakfast, because all students deserve to start the day with the fuel they need to succeed in school. We're increasing public and policymaker understanding of hunger and how to solve it. We're supporting the many food access coalitions and councils across the state to address hunger at the state, regional, and local levels. And I will talk about those in a minute. So this year, New Hampshire Hunger Solutions is planning to work with legislators from both parties to ensure that no children are hungry in school. And we're calling these priorities Feed New Hampshire Kids. These include directly certifying children whose families' incomes qualify them for free and reduced meals who are on Medicaid without their families having to fill out another form. And then also, Noah talked about how differentiated aid is based on free and reduced price meal enrollment, and that it becomes complicated for schools who are eligible for the community eligibility program. So we'd like to decouple free and reduced meals from measuring poverty in the state school funding formula. There's a better measure, and that is Medicaid enrollment. And we would use Medicaid enrollment at the same level as the reduced price category, which is 185% of poverty. So that would make it easier for schools to participate in community eligibility that I'll talk about in a minute. And it would be a more accurate measure. The next bullet is requiring that all schools offer breakfast and lunch. Brody explained that that there are some schools, about 40 of them, that currently do not either offer breakfast or not both. And then requiring schools to have an online application for free and reduced meals, which we think would significantly reduce the stigma of kids having to carry the form into the principal's office, and also the likelihood that it gets there. And then making it easier for schools who qualify for the community eligibility provision, which is a provision that allows high poverty schools to offer free meals to all students. And I'll talk more about that in a second, but right now, very few schools in New Hampshire are participating. We have the lowest participation rate in the country. And then also ensuring that all children up to 200% of the federal poverty level can eat free lunch at school. This was a recommendation by a bipartisan Medicaid direct certification study committee. Then incentivizing schools to offer breakfast after the bell. Brody talked about what breakfast after the bell is. And finally, helping more schools to offer summer meal programs so that no child has to be hungry in the summer. We talked a little bit about Medicaid direct certification. It automatically certifies kids who are already eligible for free and reduced meals without families having to fill out an additional form because their information is known through the Medicaid program. And this would reduce administrative costs. It would reduce school meal enrollment certification errors. It would reduce unpaid school meal debt, which a lot of schools are struggling with now post-pandemic. During the pandemic, all schools had universal meals. And since then, it's been very confusing what parents have to do to access free meals. And so a lot of schools are carrying school meal debt because they don't want kids not to eat in school. It increases federal funding. There's a better, for lots of reasons. And it helps more students access nutritious food. So Medicaid direct certification does not have significant cost on its own, but because of the way the school funding formula currently measures poverty, finding more kids who are eligible for free and reduced meals would increase the amount that states have to, that the state has to pay schools per the funding formula. And then just a few more notes about using Medicaid enrollment to measure poverty in schools instead of free and reduced meals. It's more effective because Brody shared that students are under-enrolled in free and reduced meals. We estimate that 10,000 children are eligible for free and reduced meals but are currently not enrolled. However, Medicaid has much less stigma, so parents and children are willing to participate in Medicaid. So it captures a much more accurate number of the students living in households with incomes equal to or less than 185% of poverty than does free and reduced meals. And finally, it creates a more accurate picture and reduces barriers to adopting other vital nutrition services like the community eligibility provision. So the community eligibility provision is complex. It is a federal program that allows high poverty schools to offer breakfast and lunch at no cost to all the students in the school. It eliminates unpaid meal charges, it reduces stigma, it reimburses schools at a higher rate for the children who were directly certified by other programs. Right now, that includes SNAP and TANF and being in foster care. And Brody talked about this. It reduces the paperwork and administration for schools, but it's important to note schools do not collect free and reduced forms. And as a result, 103 schools are currently eligible to participate in the community eligibility program, but only 2 do, because they're worried about losing those differentiated aid dollars in the state school funding formula. So that's a little bit about the legislative landscape in the upcoming year. I also wanted to mention some things that if you're interested, you could do to get involved in the work we're doing now. You can help us get the word out about federal nutrition programs. We do trainings on these programs for direct service providers or anyone else who's interested. We, as Brody shared, we help schools to increase their participation in breakfast. So if your school is interested in the school breakfast challenge, please let us know, and we can provide assistance. We obviously advocate for policies to reduce hunger, but you can sign up for our action alerts, and there'll be a QR code on the next slide. And you're also more than willing to have you send me an email. You can join our statewide food access coalition. That's a cross-sectoral group that works on addressing hunger at the local, regional, and federal levels. You can take our pledge to end hunger on our website, and you can follow us and share our posts on social media. This is just a list to show that there are a lot of different food access coalitions in the state. You will have these slides, so you'll be able to see the QR code, or you can just go to our website and under what we do, you can see the coalitions. And here's our information. And it's worth saying that New Hampshire Hunger Solutions works with lots of partners from lots of different areas, including legislators, and we'd love to work with you. We can end hunger if we do it together. Thanks so much.
Thank you, Laura and Brody. I'm just looking for Noah here to put him in the spotlight so we can do some Q&A. All right, so we've got a handful of questions here. I'm going to start with a couple for Hunger Solutions. Laura and Brody, are SNAP participation rates normalized by state income? And the second part of that question is just a statement: a wealthy state like New Hampshire would obviously have lower participation than a poorer state. So if you could talk a little bit about that.
So the numbers that we've given you are the eligibility rates in New Hampshire compared to actual participation. While there is some variability among the states, like Alaska and Hawaii get a little bit more SNAP benefits, most states get about the same amount of, in most states, people get about the same amount of SNAP benefits.
I answered the question in the chat a little bit, but I think it's important for everyone to remember that the qualifications are based upon the federal poverty level, which is the same in every US state except for Alaska and Hawaii. The federal poverty level is adjusted because of the cost for shipping goods there. I put a quote from the US Census Bureau, quote, thresholds vary by size of the family and age of the members. The same thresholds are used throughout the United States. They do not vary geographically, end quote. So our low participation is not impacted by the average household income in a state. That's not an impact. It means that those with lower incomes who qualify aren't participating, oftentimes due to, there are several different reasons why families may not, but it could be the complicated application process, stigma, misunderstanding. So what we're trying to do is better educate those who do qualify for these benefits, do better outreach and encourage them to participate because it benefits the economy, benefits their families, benefits their communities.
Could you talk a little bit about the term sufficient foods and what qualifies sufficient?
Sure. So we use the Census Household Pulse Survey, which asks a couple of different questions to get at food insufficiency. One is, did you have enough to eat in the last 7 days? Another is you had enough of food, but not always the right types of food. So that usually means that people are buying instant ramen instead of being able to purchase fresh fruits and vegetables or even any kind of vegetables. Those are the pieces that go into food insufficiency. And you can see these explanations on our website, and I'm happy to share more information.
Great, thank you, Laura. Noah, if the court has mandated that the state needs to fund an adequate education, why is it that towns are still paying the majority of the per pupil costs?
That is the $2.7 billion question. The issue is the courts have defined, or courts have given the responsibility to the legislature to define and develop a cost for an adequate education. The list of all of the staff and resources and all of those costs that were part of that 2008 study commission, where they developed the cost of adequacy, none of that is actually in statute. The only two things that exist in state law is the list of 11 courses over here as the definition of an adequate education. And then the cost of an adequate education over here is just the numbers. There's no breakdown of how the number should be calculated or what components should go into the number. So it just, right now, it just says $4,100 per pupil plus the differentiated aid. So there's a disconnect between the actual requirements and the things that I think people can agree are necessary for delivering an education, like transportation and janitors and school nurses, but those things are not listed in state statute. There's a disconnect between how the state defines adequacy and how it defines the cost of adequacy. So they don't match up, and that's been the subject of one of the ongoing lawsuits, the Conval lawsuit, which is on appeal to the state Supreme Court right now.
And what other kinds of state aid are there beyond adequacy?
Yep. So adequacy makes up the bulk of what the state provides. There are a couple other grants, larger grants that do contribute to school districts. an important one's called the Extraordinary Needs Grant, which is based on a combination of students living in poverty and property value. So if you have more students living in poverty and low property values, where it's more difficult for you to raise funds for your school, you get more money from the state on a sliding scale. There's currently a Hold Harmless grant to make sure that this districts don't lose money over the next couple of years as we transition our funding formula from the old the formula we had prior to the current budget to the one we have now. There's about $50 million a year for school building aid that the state provides. The state has some additional funding for special education. There's all of the federal money that we've talked about going towards the meals program. So there's some other pockets of money coming in, but adequacy is the most substantial piece of state funding.
Okay, we had 2 questions just come in at the tail end here. I think this last one is good. Noah, could you quickly touch on what happened recently with wealthy towns wanting to retain SWEPT?
So that is one of the other lawsuits that's happening, the Rand lawsuit. A group of municipalities that have above average property values have formed an organization called the Coalition Communities, and they are advocating to be able to retain excess SWEPT. So excess SWEPT is SWEPT revenue that's raised above and beyond what the state says the cost of an adequate education is. You'll recall the bar graph I showed earlier, where there was the green bar for what districts were spending, and then the shorter bar had the yellow for the adequacy and blue for SWEPT. In some places with higher property values, they raise more in SWEPT than the state says an adequate education costs. And prior to 2011, extra SWEPT revenue was sent to the state and then redistributed as part of the adequacy grants for other districts. Since 2011, all SWEPT revenue is retained in the community that it is collected in and has to be spent on education. If we were to go back to the old system of doing it, I believe last school year, it was somewhere around $20 million of excess SWEPT would have been remitted from those communities to the state. But that is still in an ongoing case that is being also appealed to the state Supreme Court. There's more arguments happening. So that there's I don't have a definitive answer on what might change or what the current status of that is, because it's still very much in flux with the lawsuit.
Thank you, Noah. I see folks have quite a few questions about this. As I'm sure most of you know, we're going to continue doing these webinars on Tuesdays and Thursdays through early September. So feel free to continue to join us and we can touch on some of those. I would like to thank Laura and Brody so much for their time and energy hosting these with us. Thank you, both of you, for your efforts here. As I mentioned, this recording and the 2 slide decks will be sent around to everybody afterwards. And I would love to go ahead and turn it over to Laura, Brody, and Noah just to say any closing remarks before we wrap up here.
Just want to thank you so much for including us and encourage folks to reach out to us if you have any questions about hunger in New Hampshire and how to solve it. Thanks so much.
Yeah, ditto. Definitely reach out. There's some good questions we didn't get to today, but if you reach out to Laura and I, we can always schedule a call with you or, respond to an email or provide some information. Really important, hunger. We can solve and end hunger in our state with the right public policies. So appreciate all of you, your willingness to run for public office, and hopefully we have an opportunity to work with you if you're elected. So thanks.
Yeah, and thank you everyone for being here. I did see the question about where you can find all of the data. I shared the link to the New Hampshire Department of Education's data platform where we pull all of our information from and build out our slide deck from that publicly available information. So it's 1 o'clock. Thank you all for sharing the last hour with us, and we hope you'll join us again on Thursday for our webinar with AARP New Hampshire. Hope to see you then. Thank you, everyone.